Hi, I'm Jim Kirby. I serve as the Chief Commercial Officer for Kroger Health. Kroger Health is the healthcare division of the Kroger Company, which operates 2,300 pharmacies in grocery stores across 35 states in the District of Columbia. I love coming to health. This is where the future is born. I come here to meet the movers and shakers in the healthcare ecosystem that's trying to improve the quality and access of the care that we're providing to our patients. And this is where the innovation is being presented that we all need to be paying attention to now so that we're ready. So at Kroger Health, we are looking to redefine healthcare, redefine how consumers access healthcare. And we think the retailer, the grocery store, the community pharmacy is at the center of that. Why wouldn't it be? That's where people are shopping. That's where they're spending their time in their community. And we have the opportunity to redefine the way that people are receiving care. We're not the only ones that think this way. There are other grocers and other pharmacies that also think this way. But there's a lot of common challenges that we have, but we don't address them together. We oftentimes try to figure out in our own silos, and we compete with one another. Nourishing Change is a movement that we've started that sets aside the competition, that puts the competitors in the room together to collaboratively solve things like food for health, data interoperability, clinical and payment systems, and how do we develop an empowered workforce to take advantage of what this new healthcare system has to offer. So the Nourishing Change movement, it starts with a steerco that Kroger and Hy-Vee and Ahold Delhaize and CPSN independent pharmacies are a part of. Then we'll form an advisory council of stakeholder organizations that we believe are critical to the movement, such as academia, health tech, government, universities, and nonprofits and CPGs. And then they'll have a work group that they're responsible for that will try to solve 3 to 5 problems each year. And it'll culminate with a conference each year, and it'll be hosted by a different retailer. So this next year, it'll be hosted in Des Moines on June 2nd to the 4th by Hy-Vee. We hosted it this year in Cincinnati, and now we handed the flag over to Hy-Vee. Health helps us connect to the innovators and the movers and shakers in the industry. One, by presenting the thought leaders on stage, where they're sharing their story, they're sharing their good work. In every session, I get a little nugget out of it and take something back. But then also here at the expo floor, I mean, it's just amazing the amount of exhibitors that we have here, and their products it's almost overwhelming of the innovation. I learned new this year about the diagnostic zone and what's new in consumer health. And obviously that's important to this government administration, but it's also a key for helping consumers to empower their own health journey and to focus on prevention so that we can get out of the sick care reactive system. The most valuable part of the sponsorship here is having this booth space and being able to connect with meeting participants, and also to be able to give vaccines. With the first day, we gave over 100 vaccines, which is crazy for a conference like this, where people aren't thinking about, is this the time to get vaccinated, and might I feel ill after I get vaccinated, but they're coming in droves and signing up, so that's really valuable. But for me, helping to build brand awareness of what Kroger Health is and the fact that the retailer should be at the center of the healthcare ecosystem. I'm really proud of how our booth turned out this year, from the Wall of Legends, where people will come and they can take a selfie and talk about how they're changing healthcare, and it forms this mosaic that says change. That's new for us this year, and I think really cool. But the other thing I'm really proud of is the fact that we're offering vaccines. And you can come anytime the exhibit floor is open to get any one of the vaccines that are offered behind us: flu, RSV, pneumonia, COVID. We have a full suite of adult vaccinations. And we are only one of, I think, 2 exhibitors on the floor that are offering vaccines. And we've been really busy. I think part of it's just the volume of people that are here this year at Health, and also the placement of our booth couldn't have been better. What better thing to offer at a health conference than prevention through vaccination that helps prevent communicable diseases? And we have the full suite of adult vaccinations here today. The sign shows that we have flu, RSV, COVID, anything that anybody needs and what we might recommend, we have. The thing that I want the health community to know about is the power of the retailer, the grocery store, the pharmacy, and how we are an essential part of the healthcare system, and we can be part of the solution that we're all trying to create. Health tech and AI and GLP-1s, there's a lot of conversation about that. But the grocery store, the pharmacy, the retailer is where the customers and where the patient is. And it can work in complement with digital solutions and tech solutions. That's definitely got to be a part of it in today's society. But it can't be the only thing. The trusted relationship that people have with their healthcare provider in the community in which they live cannot be replaced.